unfortunately, miscarriages will come before the end of the first trimester, which traditionally is 13 weeks. After 13 weeks, second trimester miscarriages, so usually before 20 weeks, those are luckily less common, but still about 5% of the time. It seems like that's what Ms. Tiegen went through, just given the fact that she was hospitalized. Rarely do you hospitalize somebody for a first trimester miscarriage. Most of the time, those are diagnosed when women come in because they're either bleeding or cramping. You do an ultrasound and you see that, unfortunately, the pregnancy has stopped growing. First trimester miscarriages, those are overwhelmingly due to chromosome abnormalities. So usually it's a problem that happens either at or shortly after conception. And it's something where the pregnancy just stops on its own before it reaches the end of the first trimester. Second trimester miscarriages can be due to other factors. They can be due to structural abnormalities inside the womb, like fibroids or congenital defects of the uterus or an incompetent cervix. They can be due to infections. They can be due to bleeding disorders, which it sounds like Ms. Tiegen went through. She had mentioned getting blood transfusions. It can be due to blood clotting problems, or it can even be due to certain metabolic or autoimmune diseases that the woman suffers from.
So you've been a doctor for a while. I'm assuming you've been in the room when these heartbreaking, especially these second trimester losses happen. What's that process like? Does the woman she has to give birth? And I saw they were holding the baby kind of like they would if there were, a live birth. What is that process like? We kind of got a glimpse into it on her social media there.
Yeah, so usually if they're further along, so if it's a second trimester miscarriage, oftentimes in a case like hers where she's bleeding, it sounds like maybe that triggered her body to go into labor and she ended up delivering the baby. Sometimes infections can do that as well. Something where there's an infection in the uterus goes into labor, you end up delivering the baby. Problems, one of the more common issues is something called an incompetent cervix, which is where the cervix, which is what holds a pregnancy in, is too weak to hold the pregnancy, and women will sometimes come in without any labor symptoms and suddenly be almost fully dilated and end up delivering shortly thereafter. And it's devastating. I've been in this field since 1997 is when I graduated from medical school, and my tagline that I always say to people when they ask is about obstetrics is, when it's good, there's nothing better, and when it's bad, there's nothing worse. And when you're in those situations where you have to help a patient get through the most devastating thing they could have ever even imagined would have happened, especially when a couple days ago I'm sure everything was totally fine and there were no signs of trouble, especially for someone like her who had 2 uncomplicated pregnancies in the past. It takes everything that you have to help them get through that. The most important thing that I would tell my patients who went through either a first or second trimester miscarriage is they did nothing wrong. These, like I said, are usually inherent problems either with the pregnancy or something either metabolic, structural, or infectious that they have no control over. So it's not like they did anything to cause it.
So there was a lot, as with anything with celebrities and social media, there were a lot of opinions that came out right away. Like, why are you posting these intimate photos? But then all of a sudden women who may or may not have gone through this, maybe they've had a friend, a sister who has gone through this, were saying, no, people need to see this. What are your thoughts on this and the women who are kind of speaking out and saying, hey, social media is good, bad, and otherwise?
So 1 in 3 women will suffer a miscarriage at some point in their life. Those are just the odds. And when I had patients who went through it, they didn't want to talk to anybody. They didn't want to tell anybody. And then over time, they would find out that people that they were very close to went through the same exact thing, and they never knew. I had patients who would tell me after a miscarriage, they would come back and see me a couple weeks later and they say, wow, I found out my mom had 2 miscarriages and I never knew. Or some of my really close friends that I see on a daily basis went through this a year or 2 ago and they never told anybody. And I said, well, of course, it's not really anything that you want to share because it's something very painful. And I was a little bit taken aback myself when I first saw the pictures, thinking, why would anybody put this out there? Such a raw, personal, painful moment. But then again, the more I thought about it and the more I reflected back upon my own experiences with patients, it lets women know that they're not alone. Because like I said, it unfortunately is not an uncommon phenomenon.
Yeah. A lot of people were also saying that oftentimes when you have, a child loss, these are some of the only photos you will have of your child.
Mhm.
And then adding in there also, it's like you don't you don't want to be ashamed of it either. So if it were a live birth, you would post these same photos. So some also a little bit more perspective on that as well.
Exactly. And I can't imagine. I think she even I saw in one of the articles I read that she put something in driving home from the hospital without a baby. I can't even imagine how painful that must be for people. So yeah, it's believe it or not, it's a very tragic event that in a weird way seems to be helping other people get through their own tragic events.
Mm-hmm. When you have these kinds of situations in your patients, what do you tell them moving forward? How do you help them get through it? Do you recommend counseling? Do they see you more often? What is that process like?
Sure, it just depends on the patient. If they're struggling and they need counseling, there's plenty of resources that we hook them up with. The good news for people who have first trimester miscarriages is that one miscarriage does not really have any bearing upon their future ability to get pregnant or stay pregnant. We don't really even think someone is considered to have a problem with recurrent miscarriages unless they were to have 3 in a row, and that's well below 1% of the population has to suffer through that. The second trimester miscarriages are a little bit trickier because there could be more medical things behind them. They're not just all chromosomal or almost all chromosomal like first trimester. So those usually involve a little bit more conversations with your doctor, maybe some more tests, maybe an ultrasound or two, sometimes some blood work, just to look to make sure that what happened isn't something that is at high risk of recurring again. And then usually once they get pregnant again, you just watch them a little bit more closely through the second trimester to make sure that they're not running into the same issues.
Last question here. I don't want to take too much of your time. I really appreciate you talking to me today. Somebody who in Central Ohio, in the Columbus area, if they're going through the same thing or a similar situation, what is your advice to them?
That it is unfortunately very common. It is not their fault. They did not do anything wrong. And it does not mean that they can't have as many children as they would like and have as big a family as they want. The physicians in this city are very, unfortunately, well versed in these miscarriages, and they'll be able to reaffirm with them that this is unfortunately just usually bad luck, and it's something that they'll get through, and they will have as big a family as they can handle. Sometimes bigger than they can handle.